Good afternoon. I'm Tre Tailor. Thank you again for joining us for another Coping with COVID tips, information, and updates on how we are living and surviving and moving through this new normal in our lives called the Corona-19 virus. Today, I'm so happy to have a State Representative, Attorney Todd Rutherford with us. Todd, thank you so much for taking time out of your busy day to join us today. I appreciate it.
No, thank you. Thank you so much, Trey, for having me.
Absolutely. I really wanted to talk to you today because, of course, as you know, yesterday the president rolled out his plan for reopening the country. And our governor also this weekend is reopening the boat ramps. He's formed a task force, he and the president. So I want to know what you think that means for us here in South Carolina in light of the fact that our cases of coronavirus are still going up.
So let me address it from beginning to end. And first of all, I do follow what the president does, but no one else really should. He has no clue what's going on, and it's not his fault. He's simply not that bright. Right. And so we don't hold it against him, but we do kind of watch and listen.
Right.
What you know and what we all know is that COVID-19 has affected the world in different ways. And one of the ways that it has affected this world is because New York City is completely decimated by what is going on. Yes. New York City is one of the most dense places on earth in terms of population. You got a population between 8.5 and 9.5 million people squished into an area about the size of downtown Columbia. That being said, South Carolina is just completely different. If somebody lives in South Carolina, this is what they need to know, and these are important numbers. And I'm going to look at my phone, so this is what I'm looking down.
Okay.
And this is from the South Carolina Hospital Association. This is as of yesterday. Actually, this is as of April 15th. So we're about 2 days behind, but the new numbers are very similar. The total number of COVID-related deaths in South Carolina as of April 15th is 105. And that is up from going back to April 9th, where it was 67. New COVID positive infections in South Carolina is right now at about 110, 120, somewhere around in there. Total, and now mind you, that is a number that is a lagging indicator. What that means is that these numbers are reflective of people that were tested, some of whom were tested over 2 weeks ago, some of whom were tested 7 to 10 days ago. Total number of COVID positive infections in South Carolina altogether is about 3,700. Okay. Now, mind you, South Carolina's total population is about 5.5 million. Right, the population of the greater Columbia area is about 400,000. The population of the city of Columbia is about 120,000. Here are the crucial numbers, and this is what people should grab a hold of, and this matters. The total number of COVID inpatients in South Carolina, those are COVID-related patients in hospitals in South Carolina, is 345. Okay? 345 people in hospitals in South Carolina. There are 65 acute care hospitals in South Carolina that receive inpatients. There are about 5 more, the VA being one of those, that are also acute care hospitals, but some of them are acute care long-term, for a total of about 70 acute care hospitals. Out of the 65 true acute care hospitals, the total number of hospitals that have COVID-19 inpatients, 44. Now, what does that mean? It means that South Carolina is different. We don't have the population density that New York has. We don't have the population density that Chicago and Detroit have. And as such, we did not see the overrunning of hospitals the way that New York did. And again, and you can cut me off whenever I go too long, but this is data that, I'm on a call with MUSC this morning, got a call with DHEC. And so this is where I'm getting this from, and I'll regurgitate it.
But these are important numbers. These are important numbers to know.
All right. So out of every 1,000 people that DHEC test, they are running about a 10% positive. So if DHEC tests 1,000 people, they're getting about 100% positive. 100 positive out of that 1,000. MUSC down in Charleston is getting about 60 positive out of that 1,000. They're at 6% positive. Out of that 100 that test positive, 80% of those people go home that day. So 80 people out of that 100 go home that day. 20% go in. 20 of those people go in, but 80% of that 20 go home the next day. So what we are down to, for every 1,000 that DHEC test, 6 people enter a hospital in South Carolina for long term, one of those 6 typically ends up on a ventilator.
Mm-hmm.
And those are our numbers, even lower in Charleston with MUSC. Again, 6 people entering the hospital out of every 1,000 with a population of 5.5 million. That being said, what we're looking at and what we've always been worried about, COVID-19 is a very deadly disease and is extremely contagious, and that has been our concern. However, the reality is that in South Carolina, we continue to be okay.
Right.
Now, it doesn't mean that nobody's getting it. It doesn't
Right.
mean that people aren't getting sick. It doesn't mean that people aren't dying. But what it does mean is that trying to achieve that balance and making sure that businesses are able to operate, people can go back to work with the balance that we understand that people can get sick and the people will die.
Right.
That's a hard balance to achieve because people also die of starvation.
Right.
They also die because they commit suicide because they can't take social distancing and the social isolation. People die because they are killing one another in very close confines. We're seeing the rates of criminal domestic violence go up. So there's always this fine balance to be achieved with it when government operates and government does anything. And that's what I think the governor is working hard to achieve. I don't know what the president's doing, but I can tell you, I sent in a request to ask that the governor reopen the public boat ramps.
Did you? Okay.
What is still in place is that no more than 2 people can be on a boat unless they're family members. And boats, because of their very nature, are isolated from the general population. I don't see any problem with people going out to public boat landings and getting on boats.
Mm-hmm.
I also sent in a request the day before, which would be on Wednesday, to ask that the governor allow hospitals in South Carolina to start doing elective surgeries. Why? Right now, South Carolina has about 5,500 empty hospital beds. Those empty hospital beds are costing our hospitals a rate. MUSC, for example, they're losing about $30 million a month. And at the current rate, they may run out of money by mid-June. These are real numbers.
Right.
These are real jobs. When you see Prisma laying off 4,000 people, these are nurses and doctors that are being laid off. These are not people that are just doing administrative jobs. These are nurses and doctors because they don't have anything to do. We've got to achieve that fine balance between working and getting back up and running and our health. And that's a very real thing we've got to work on.
Right. So you're saying basically that in comparison with many of the cities in the rest of our country, South Carolina is really not doing as bad.
South Carolina is okay.
Based on our population. And
based on our population, based on our population density, based on our numbers. We did not want our hospitals to be overrun, and they are so far from being overrun, they're now laying people off.
Wow,
so
really?
You've got a problem where MUSC has sent doctors down to Atlanta because they are, last Thursday, I'll give you data from last Thursday. Last Thursday, MUSC is an 800-bed hospital. They usually are running 100%. They had 300 empty beds last Thursday. Total COVID-related patients at MUSC in Charleston, 4. 1, 2, 3, 4. And so because of that, you've got a hospital that is about to shut down, waiting for the surge of COVID-19 related patients that simply have not come. And that if they come right now, our hospitals tell us they are ready to deal with it. DHEC tells us they are ready to deal with it. And so now we've got to get working on getting this state back to work, getting people fed, getting them employed, because what we know is the federal government may be sending down $1,200 checks, but there's nothing you can do with them. Right. Most places are still closed, and most people are not getting their unemployment insurance. They can't even call in because we've got so many people trying to call in. We've got to get back to work.
So, Todd, what do you propose? And what do you propose as far as getting South Carolina? And let's not talk about the country because we're in South Carolina. Let's talk about what your vision is or what you would like to see happen for our state.
I spoke to MUSC today, and this is one of the things that we're working on. We're going to talk to DHEC about this as well. We're going to look at, first of all, seeing what the government can do about commandeering some hotels, because no one's staying in hotels right now. We're going to start working on mobile testing when we can go out, we can get a result back in an hour that someone is tested positive. We then send that person not back home, but send that person to a hotel where they can be isolated and quarantined until they are not showing either symptoms or they are no longer contagious. Once we can do that, then we can get that person in, do contact tracing, go back to see where they've been, who they've been in contact with and test those individuals. When we can do successful testing, when we can do successful contact tracing and isolation and quarantine, that is when we can move through this. We're not there yet. We are never, I don't know when we'll be at a point where we can fully open back up. But we are at a point where if we can do accurate testing, we can do good contact tracing, where we can do isolation with our healthcare providers and the state and the government, and we can look at making sure that our minority communities are not suffering, then we can start doing this gradual approach to reopening. There are those out there that want you to believe that the sky is falling. And listen, you look around us, the sky is falling. But South Carolina is in place to catch it, to make sure that we don't do too much. If we do, to pull back. We were very fortunate that we didn't have the Carolina Cup in Camden, 150,000 people showing up. That we didn't have 5 Points doing their St. Patty's Day with 75,000 people showing up. That all of our festivals, all of them are in the spring. Soda City and fabulous event every Saturday. People would have showed up by the thousands, and people could have gotten sick. They did not do it. And we should not have those festivals anytime soon. But because we didn't, we're in a good place. And we need to make sure that we are using that good place to allow people to go back to work, the economy to start chugging again. Because when we look at it using gross numbers just in this state, 4,000 people infected out of a population of 5.5 million is enough to say with any data, with any healthcare provider, that we are okay and start looking at how to open things back on a gradual basis.
Right. So after you kind of talk to MUSC and DHEC and that testing kind of gets into place, or whatever the plans are for that, do you think that the rollout should be industry by industry,
yes,
large business by small businesses?
Step by very tiny step. For the past 2 days, I've sent things to the governor on the request of the boat landings, of the request of the elective surgeries. Today I didn't, because I want to see what those steps get us and where we can go with this. One of the most important things to remember is this. There are people that would follow me and go, oh my God, he's so wrong. We got to stay away from each other for the rest of our lives. It's not possible. And what happens is, in a state like South Carolina, especially as it gets warmer and it stays warm, people are going to revolt. You can't have people in South Carolina locked in their house. In particular, I live in downtown Columbia. In downtown Columbia, I can walk outside of my house and I'm not 12 feet, 20 feet close to anybody. So requiring people to shelter in place with no end in sight, it's not going to work. You're going to see the revolts here that you see in Michigan, that you see in other states where people are saying, you know what, I'd rather chance getting COVID-19 than be stuck in my house for another 3 months during the summer in South Carolina. It's not going to work. And I think a lot of people are missing the fact that some people don't live like others. There are some people that live in 800 to 1,000 square foot houses with 8 to 10 people. And socially distancing means walking outside and going to the store, because you're further away at the store than you are in a house with 10 to 12 people in 1,000 square feet. We've got to be mindful of how people live. We've got to be mindful of keeping people safe. And we've also got to be mindful of those people that we have scared the bejesus out of.
Right.
We are now telling it's actually okay. And that if we don't get back to work, we're going to lay off even more doctors, lay off even more nurses, and we're going to close even more hospitals because we won't have the ability to deal with it.
Right. Well, you talk about keeping people safe, Todd. And I mean, you made a great point, interesting point about how people live. Different people live different ways. And if you're talking about, like you said, a small home with a lot of people, it could get not only cramped physically, but emotionally, mentally, So how do you keep those people safe? How do you keep those people sane?
I think that one of the ways that we do it is letting them get to work as soon as we can, not too soon,
right?
But as soon as we can. I'm not Donald Trump. I'm not going to set an artificial guideline, but we never knew the value of work in our lives until we couldn't go at all.
Yeah.
And a lot of us never knew the value of our lives. And then we got laid off and we realized how important it was to us. If we don't put people back to work as soon as we can, and in as safe a manner as we can. So I know that those people out there, he's crazy. No, as soon as we can and as safely as we can. If we don't do that, this economy is going to collapse, and there's going to be nothing left to pay for people that need help. And that's a real issue.
Yeah. Yeah. So when do you think this all should happen? When do you think the rollout should happen? I know that you mentioned that, as soon as you guys talk to DHEC and MUSC and kind of figure out the testing, but do you have a timeline? Do you, as you said, don't listen to the president, but,
Yeah.
he's thinking May, June.
I think that what he is anticipating, the reason why I've stopped saying this, but I see what he's anticipating. We all believed early on that COVID-19 was going to act like the flu, and
Right.
that as it got hotter, people don't worry about catching the flu anymore.
Right.
But I saw something a week ago that said that it may not be that way. And so that's a very real thing. So I'm not going to rely on that anymore. And so if you're not relying on that, you're going to create a false timeline if you say anything. I think even understanding idiocy is important as you deal with our president. And if you want to be hopeful and you want to tell people there's a sun rising at the end of this horizon, the only way to do that is to keep creating deadlines. So I understand some of his idiocy. However, it would be irresponsible for anybody to come out with a timeline right now for full-scale reopening. It has got to be step by step. And as we get things in place, like apps to do contact tracing, like hotels to house those people that are asymptomatic but positive, or symptomatic but only mildly symptomatic, to house those people and keep them away from their families. When we're able to do that, which is probably honestly about a month out, that's when we can start looking at, okay, we can open up things and allow people to be a little bit closer. I don't know the next time we're going to be able to open up a school. I'll be honest with you. I don't see that happening anytime soon.
And because what? Why? Because of the schools? Because it's so many kids, and the kids.
So many kids, and they're too close.
So many kids. Yeah, people.
And they're too close. And that, unfortunately, is going to be our reality for a while. What I've advocated from the city and from the state is to allow restaurants to place tables outside, so that when people pick up their to-go food, they can sit down and eat it outside on a table that is sanitized, and they can be 10, 12 feet away from their neighbors, 6 feet away from their neighbors, so that they don't risk giving it to anybody else, but so that these restaurants can stay open. There are a number of people that are listening to both of us talk that may work for a landscape company, and they got paid cash under the table. They're not getting unemployment. Maybe they didn't file taxes, so they're not getting the $1,200. And that person is going to Harvest Hope Food Bank and being told that they're close to running out of food. These people have got to be fed, and their life is no less important than somebody that is at risk for catching COVID-19. And we've got to understand that and risk that and understand that balance.
Okay. So no schools, but restaurants. I love the idea of the restaurants at least opening so that people can sit outside, because that's going to, of course, employ more people, if for nothing else, to go out and sanitize those tables.
That's right.
So then if we think about restaurants, what would be the next logical step? Who would be the next?
I talked to somebody the other day, and they talked about restaurants placing tables inside, spacing them enough away that you could allow people to sit down. But honestly, I don't know our level of comfort with going in a room that is as small as most restaurants are, even if they're larger restaurants, and sitting at tables, even with our family, but still that close to other people. We don't know how far it carries in the air. And so it may be uncomfortable for us. However, there are those people that it may be comfortable to. And if they are willing to go in and sit in that restaurant and take that risk, it's something we're going to have to deal with. Dr. Oz, another seeming idiot, said that, 2% to 3% mortality for our school children may be acceptable to some. Well, that's not acceptable to anybody. However, there are those people that want to go back and sit in a coffee shop and sit in a restaurant and believe that they can socially distance. And given the numbers, and let's look back at the numbers, 4,000 people, and let's use large numbers. Let's say it's 10,000 people infected in South Carolina out of a population of 5.5 million. The numbers are still on the side of those people that are willing to risk going to sit in that restaurant that they may not ever get it.
Right. So after restaurants, then what industry you think? I mean, and I agree with you, being inside, many restaurants are not even large enough to place tables that far away. And I do agree, you're right. People are already side-eyeing people in the grocery store, so to be able to sit close or far enough in an enclosed area, I think is unrealistic. But I love the outside thing. So if restaurants are one of the first industries, what would be rolled out next, in your opinion?
I think you can look at small offices and small retail who are able to now limit the number of people that come into stores. I went to Academy Sports the other day, and they had lines on the sidewalk where people had to line up. They had somebody at the door limiting people who could come in. They were sanitizing all the buggies before people grabbed them. And I think that is a socially acceptable, safe way to do things.
Yeah.
I know that there are those people that disagree with me, and they don't have to go. They can simply order it online. But with the recognition that ordering online is going to destroy the economy in this state, we have got to, again, work on getting back to work and do so safely. I do not think that anyone over the age of 65 should be able to go out and go into these stores and go into these restaurants, because it is very dangerous for them. The majority of our deaths in South Carolina, and I believe it's almost 80 out of 105, have been with people that were over 80 years old. We recognize that is the danger subset.
That's the pre-existing conditions.
Exactly. Well, age being one of them.
Age, yeah.
Yeah. And so they shouldn't go out. And even when it starts getting warm, they should not go out until we have a vaccine. And I know Moderna is working on one, until we have a magic medicine. And I know Gilead saw some hope yesterday. But, and I got to say this, we live in the greatest country on earth. We do. Now, again, this country, one that had slavery, one that we had to go through the civil rights movement, and one until just recently had the Confederate flag on the State House grounds.
Yes, yeah.
We still live in one of the greatest countries on earth. I do not discount our scientists, our doctors, our researchers, not one bit. I don't think it would surprise anybody if we went home tonight and saw on the national news that they had come up with a cure for COVID-19, because we are that resilient, we are that dynamic, and we should applaud that. That being said, until that happens, it's a gradual, step-by-step approach, looking at industries that say, hey, I think we can reopen. And when we can do that and do that successfully, we should.
Yeah, I want to say hi to Johanna Bridgette, Katrina Bridgette, Barry White, and also Nigel McAfee, who are all watching online here in Columbia. Tanya Ridley is watching from Raleigh, and we appreciate you. We don't want to hold you, but if anyone does have a question, well, yeah, Nigel just said, hey, Trey. Hi, Todd. Todd, bring us Todd, bring us some business. Yeah.
I'm working on it as fast as I can.
Yeah, and you are, and yeah. So what you're saying, Todd, is interesting too. Yes, let's reopen the state, but to certain people, to those people who are not as vulnerable to catching COVID-19.
That's correct, and the governor's order is still in place that no group of persons of 3 or more should be assembled anywhere outside of the home, which means that anytime there are people that are congregating and there's more than 3 of them, law enforcement has the right to break that up. And so that's still in place. And so wherever you go, whatever you do, remember that is still the law and it can be enforced. There are a lot of things that have come out of other orders that I vehemently disagree with, and I can take it back a little bit.
Yeah.
When it first started, you had a number of local governments deciding that they wanted to do lockdowns. And again, I understand people want to jump to do whatever they can to save lives, and people should. But remember this, we are a nation of laws and we are a state of laws. And what the governor and I spoke about, because I kind of pushed back on a lot of the shelter in place stuff, what he and I spoke about is, if someone is driving their car, is it probable cause for an officer to pull them over and say, hey, it's 11 o'clock at night, where are you going? Well, I don't believe that it is. And if you give an officer the belief that it is, then whose lives do they typically interfere in first? People that look like me, because that's the way that it has always gone. You had Folly Beach, the city of Folly Beach decide, or the town of Folly Beach decide, that they were going to close down the beach to anyone that lived outside of Folly Beach. Now, these are people that to a great degree have been waiting to kick everybody, especially people that look like me, off of their beach and allow it for just them. Well, as I stated to them, if that's okay for you, then what the city of Charleston should have done is said that no one that lives in Folly Beach can come into the city of Charleston, and just lock those people down. You saw a request go to the Attorney General, Alan Wilson, that came out of Hilton Head, because I'm told that the town of Hilton Head wanted to do the same thing. They wanted to close off the bridge to anyone that did not live or have a Hilton Head address on their driver's license. Well, on the other side of that bridge is the town of Bluffton, and Bluffton should have done the same thing. And said people from Hilton Head can't leave and come into Bluffton. Well, if that sounds just ludicrous to you, if it sounds insane, it's because it is. And that is why I don't believe that cities and towns had that right. It must come from the governor. It must be statewide, because criminal penalties in this state must be statewide. And so that you and I don't risk driving to Pawleys Island, going on to Pawleys Island and getting pulled over and them asking us, who are you and where are you from? Well, it's none of your business. And it's none of your business because we're Americans, we're South Carolinians, and the law applies to us just like it does to you. We can't have that. And so that is why initially you saw some pushback, and why even now, I know there's a lot of talk about churches and whether we should ban churches from getting together. But there's the First Amendment, and it is the first amendment to the Constitution, meaning it is that important. And I don't know whether we have the right to tell a church that they can't assemble. Because what we have to anticipate is at some point, some megalomaniac idiot like the President Donald Trump may say, I don't want churches to get together, because he knows that that's where Black people congregate, and that's where they came up with ideas during the civil rights movement to push back against segregation. Imagine if they could have told us then that we couldn't congregate in churches.
Right.
Everything has to be fair and balanced. And for every action, there's an equal and opposite reaction. And we've always got to make sure that we're not asking law enforcement, people that we've never agreed with to a great degree, because they're the ones that, were out there on the front lines firing water hoses at Black people during the civil rights movement, now asking us to police Eau Claire, Keenan, and tell people they got to be in their house. They ain't going out to the rich neighborhoods telling them they got to be in their house. They're going to come to our neighborhoods and do it first. And that's one of the things that we got to be careful about.
So, Todd, again, you make a great point. We have state laws, but then we have laws in specific cities. Every city can, I guess, not make up their own laws, but have their own ordinances, like you said, So do you think that when something like this happens, if a state law should be across the board to every city, municipality, every town?
All right, so South Carolina is a legislative state, meaning that the General Assembly runs this state. Cities and counties have the rights and the authority that were given to them by the General Assembly. Unless the General Assembly has given it to them, they don't have it. And the reason why that's important is because there's a town called Turbeville. And if you drive through Turbeville and you speed, they have a camera up. They had a camera. No, I was Ridgeland had a camera up that was catching speeders and sending tickets to them in the mail. Well, it violated state law, and we made them stop. And if we did not, then you'd have a bunch of cities and counties out here just running cameras,
doing the same.
Nobody ever doing nothing but safety, just charging people left and right as a revenue generator. We don't have that in South Carolina. We enjoy our freedom, and the General Assembly in particular, and the Democrats in the General Assembly, make sure that those freedoms are protected. In order to do that, you're going to give up something. And what you give up is allowing the mayor of Forest Acres to say that the city of Columbia can't come into Forest Acres. And in order to make that happen, laws happen in South Carolina. The authority was given to the governor to do certain things. But we also did not give the governor the authority to supersede every law out there. And when he told us we couldn't gather in groups of 3 or more, he relied on a state law that the General Assembly had already passed. If he had said that no group of 2 or more can assemble, I would have said, Governor, that's not legal. Now, again, I recognize that we're trying to save people's lives, but we don't do so by breaking the law ourselves.
Yeah. Sharon Rapley says, hi, Trey. Hi, Todd. She says she needs to get to her dentist, Palmetto Dentistry.
So they are waiting for her. And dentists, oddly enough, and a great question, because dentists have been one of the hardest hit by this because of the safety concerns of someone opening their mouths and saliva and how it spread. But with our understanding of it, and with PPEs the way that they are, I think you're going to see that gradually coming back as well, because these are healthcare professionals that understand what goes on, and given the ability and the access to PPEs, can be protected enough to make sure that they are protecting the patients as well.
And I was going to ask that. So when do the healthcare, when can we go back to our dentist, to our doctor? When do you see healthcare facilities being part of that?
Well, I've already given, and I've already made that request to the governor, and he's given it to the hospitals for them to start doing elective surgeries. And so I think you're going to start seeing that within the next week or so. Doctors saying they think they can do this, and with given access to PPEs, they think they can make it and do it safely. And I'm a lawyer. I don't have any right stepping in. The governor's a lawyer too. He doesn't have any right to stepping in. He's listening to DHEC. I've listened to DHEC, and I believe in the next week or two, you're going to see doctors' offices opening up. MUSC told us, and I may have said this, and not, I'll say it again, it's important, that they were losing $30 million a month dealing with COVID-19. $30 million a month. MUSC said that they would be out of money. We can't have hospitals closing. We can't have doctors' offices closing. We can't have people not having access to health care because we have, again, and I'm not minimizing it.
Yes.
Every death is too many, but because we've got 105 deaths, we still have to make sure that people can be safe.
Yes. Yeah. Yes, honey, it matches. I'm sorry. Yes, it matches.
Yeah, I've got 2 kids myself, Trey. I don't even hear it. I mean, it is.
Right.
I'm enjoying it. Let him ask the question.
Does it match? Yes, it matches.
It matches my finger.
Yes, honey, it matches. Yes, it matches. Well, I guess I should be glad he wants to match, right?
Absolutely.
Hey, Terrell Cannon, and this doesn't have anything to do with this, so I'll just ask Terrell to contact you. He wants to know what's up with the HOA bill there this year.
And I assume, and we use so many abbreviations, I assume he's talking about the homeowners association.
Homeowners Association, yeah, me too. Yeah,
which is crucial because we had a number of homeowners associations in this state that were taking people's houses for minimal sums of money. But every piece of legislation at this point is on hold. We have not been able to get back to work except for that one day that we went back in. And honestly, I don't know what we're going to do in even June, July about getting back in and handling the people's business. But I can tell you that we are very concerned about it and we've got to keep moving.
Okay, great. Todd Rutherford, thank you so much. Is there anything else you can share with us, Todd, about the coronavirus and how we should deal with it, cope with it here in South Carolina, and what you think will happen, your crystal ball, what you see happening in the future?
No, but the biggest thing I think that people should grab a hold of, and I need to talk to WIS and make sure that they are putting this number out there. The one thing I want people to hold on to is that we've got to look at hospitalizations. Right. That is our indicator of where we are in this state. Right now, we still got over 5,000 empty hospital beds. If people start to see those empty hospital beds filling with COVID-19 patients, then we will know that we have to take another step back. Until that point, if you don't see that increase, if we're still flat, that should be the indicator of where we are and where we need to be. If we're still good on that number, then we should be looking for those steps in order to bring people back to work, to stop people from starving.
Want to say hi to Cynthia Watson. Also, Bryson Caldwell wants to know what are the plans to reopen with municipalities already having the authority to continue stay-at-home orders.
I don't believe that municipalities have the authority to continue stay-at-home orders. That won't stop them from doing it, but the level of enforcement for those stay-at-home orders has been minimal at best. And so I believe that people should stay at home. If they have a comorbidity, if they're older, they should stay at home. Mm-hmm. I believe that overall we're going to benefit by people staying at home, and we have already benefited by people staying at home. However, again, the law is important to me. I don't believe that a city has the authority to enforce anything other than what the state gives it. The governor's orders are in place. You can't go outside and be in a group of more than three or more. If you're on a boat, you can only have 2 people if you're not related to them. So I think those orders should stay in place until we figure out how to do a better job of making people be able to, or allowing people to get together and do it safely. But watch those hospital numbers, watch those inpatient numbers. Let's make sure that they don't go up, and let's take our own safety precautions to make sure that that doesn't happen.
Want to say hi to Sandra Best. Thank her so much for watching on another page, SC Dollars Matter. My natives are getting restless in here. Nap time is over. Right. Nap time is over, and the 4-year-old's running around naked, which he likes to do that during this time.
It happens.
But Todd, listen, thank you so much for joining us, for sharing your information. I've been leading every Coping with COVID with a reading from Jesus Calling. If you would mind, let me read this right quick, because I know you work and you got to get some clients you got to get back to.
That's right.
This is so apropos. This says, I am training you for steadiness. Too many things interrupt your awareness of me. I know that you live in a world of sight and sound, but you must not be a slave to those stimuli. Awareness of me can continue in all circumstances, no matter what happens. This is the steadiness I desire for you. Don't let unexpected events throw you off course. Rather, respond calmly and confidently, remembering that I am with you. As soon as something grabs your attention, talk with me about it. Thus, I share your joy and your problems. I help you cope with whatever is before you. This is how I live in you and work through you, and this is the way of peace. Todd, we need some peace, and we thank you for being one of those peace keepers and peace bringers in our state legislature. You are fire, and you are, I mean, you are just a strong voice for our community. And I'm glad I'm in your district, and I'm glad I'm in your state. So.
I am too, and I am honored, and God is going to get us through this. He always does me on the path.
Absolutely.
And whatever I am no match for a 4-year-old. So God be with you as well.
Thank you so much. Todd Rutherford, Attorney Todd Rutherford, State Representative, South Carolina. I'm Tre Tailor. Thank you so much for joining me for another Coping with COVID. Actually, a little bit later on, I'm going to talk with 2 hairdressers to tell us how to deal with our hair while the hair salons are closed, natural and relaxed hair. We're going to talk to some ladies who tell us about that. Thank you, Todd. Have a great day. All right. Thank you all for watching.